My name is Stephen Moscone. I'm the Vice President of Advisory Services at CDSPI. Tonight, you're going to learn about the common instances of dental malpractice, why they occur, and best practices for reducing your exposure while cultivating a patient-focused practice. We have a lineup of speakers for valuable information this evening to share, so let's get started. Just take a quick peek at the agenda. Ed Dermit, CDSPI's President and CEO, will begin with a CDSPI malpractice update. He'll be followed by William Cole, examining adjuster at Crawford & Company. And William will discuss the dental malpractice claims process. He'll be followed by Colleen O'Neill, litigation lawyer, Dolden Wallace Follick, LLP. And Colleen will take us through the common claims and how to avoid them. Renata Whiteman, senior insurance advisor at CDSPI, will talk about CDSPI's malpractice insurance, and we'll conclude the formal presentations with a dynamic question and answer session. We started the recording, so if you need to drop off, we'll be sending a recording of today's session out within a week. Feel free to submit questions in the question and answer function, and we'll answer as many as we can after the presentation. Also, thank you to those who've submitted questions in advance of this presentation. We've shared them with the speakers, and they've attempted to include them within their presentations. Before I hand things over to Ed, I want to highlight the malpractice webinar we hosted last year in October. We received a huge amount of interest and requests for more. It was the inspiration for tonight's session. We're calling it Chapter 2 of the conversation. Hopefully you're able to attend. If you were not able to join us, you can find it on our YouTube channel, as well as our webinar, or through the QR code you can see on your screen there. And now, without further ado, I'll hand things over to Ed Dermit, President and CEO of CDSPI.
Thanks, Stephen. Well, thanks everybody for joining us tonight. What I'd really like to do is a couple of things before I hand you over to the experts who can really share some insights with you. Just give you a little bit of context around CDSPI, and I think understanding who we are is important perspective for the conversation and the information we're going to give you today. For those of you that are unaware, CDSPI is the largest provider of malpractice insurance outside of Ontario. So in every other province beside Quebec, Alberta, and Ontario, we are pretty much the malpractice insurance provider. And as an organization, you know, if you're not as familiar with us, there's probably three takeaways I'd like you to have, or I'd like to leave you with. One is that we're a not-for-profit organization. We serve the interests of dentists. We don't have shareholders or owners that we're beholden to. A second important point is that we are a member benefit. The 10 provincial, territorial dental associations and the CDA actually elect our board of directors, and we are an exclusive member benefit of the CDA, the provincial and territorial dental associations. And lastly, our advice model is important. You know, we specialize in dealing with dentists only. We serve no other types of clients, customers, segments, and our advisors are salary-based advisors, and so they're actually working in your best interest. Next slide, Stephen. So what I'm going to do is I'm going to just actually share with you some of our malpractice claims information. And in this particular slide, I'm not going to read every particular instance, but as you kind of glance through them, to give you a little bit of context, these are some of the largest malpractice claims and settlements that CDSPI has had in our history. Many of them were multi-million-dollar settlements. And I think when you read through some of these examples, there are kind of two themes. One is that mistakes happen. You know, there's no dentist that deliberately goes out to harm the patient. I mean, that's stating the obvious. But despite best efforts, you know, dentists in Canada that are highly trained, amongst the best in the world, unfortunately, sometimes things don't go as planned. And they can lead to patient harm through, you know, no direct fault of the dentist or no deliberate fault of the dentist, but it happens. And that's why we have malpractice insurance, you know, to protect both the dentist and the patient. So there's some examples there of some of the larger claims and settlements that we've had direct experience with. Next slide, Stephen. I'm also going to give you some statistical information. So these are some examples of reported claims. About 50, just over 50% are related to procedures. So you can see just broad, these are very broad strokes, right? The largest number are based malpractice claims that result from extractions, followed by implants, crowns, root canals, things of that nature. And then the next slide, you can see the types of complaints that lead to reported claims. So persistent pain infections, numbness as a result of a procedure, complications, extracting the wrong tooth, misdiagnosis. Oftentimes it can be related to a missed oral cancer diagnosis. Those are some of the big ones you saw in the earlier slide. Those were some of the biggest claims there. Next slide, please. And just for some context, you know, I mentioned that CDSPI is a not-for-profit. And why that's important is because when we have surpluses as a not-for-profit in the malpractice insurance program, those surpluses go back to the dentist through the form of reduced premiums. So you can see that going back to 2007, when our premium for $3 million of coverage was about $2,100. We've decreased the premium in 8 of the last 16 years. We had a bit of a bump there in 2022, where it did result in increased premiums, but we can, you know, we're glad to say that over the last 2 years, we've been able to see that reduced trend in premiums. And I will say for those of you where there is a $2 million minimum in your particular province, this is based on $3 million of policy coverage, not the $2 million if you're looking at comparing premiums at a high level. So with that, I'm going to turn it over to William. Just by way of quick introduction, William is an independent adjuster with about 30 years of claims experience. He is with Crawford and Company. And we're really pleased that William can join us here today because of his experience in particular in handling malpractice claims. So we're really pleased, William, that you could join us and provide your perspective, which I know will provide a lot of value. So I'll turn it over to you.
Okay, thank you. Next slide. Okay, what I'd like to talk about a bit today is the actual malpractice policy itself, what's in it. I'm going to talk about the claims process, sort of what goes on behind the scenes, or as how I assist the dentists in dealing with these claims. I'll give you some examples of the claims that I've seen and some ideas and suggestions of what you can do to help yourself maybe try and avoid some of these claims. Next slide. Okay, so I want to talk about a bit about the policy coverages. This is a high-level overview. The policy is considerably more detailed and will always be the preferred documentation when dealing with claims. Obviously, the dentist is covered as long as he's licensed in the province where he's operating, but also his employees are covered, the dental hygienists, the CDAs, the dental nurses, and any companies that he may own. Sometimes your dental practice is in a corporate name, and if you're the owner, the company is covered as well. Dental therapists, and there is what's called, in cases of non-practicing status, so if you're retired or even deceased, claims can still come in, and we will deal with them for as long as need be. One of the sort of gray areas in coverage, just so that you're aware, is dental hygienists. They are definitely covered under your policy as long as they're an employee, but they also have their own separate insurance through another insurance company. So the question is when a claim occurs and the treatment's done by the hygienist, which policy should be paying for it? Both policies say that they're secondary to any other policy. And in this case, we have an ongoing dispute with the other insurance company over who has to pay for these claims. And it's been ongoing for 15 years and hasn't been resolved yet. But so anyhow, the coverage, the insurance company will pay all amounts in excess of the deductible for each claim which the insured is legally liable or for which the insured is determined to have assumed liability under contract for compensatory damages sustained by any person arising out of malpractice, error, or mistake in providing or failing to provide professional services in the practice of dentistry. So one, you have to be covered by the policy, but the incident that occurred actually has to involve the practice of dentistry. And we have seen cases where that's not the case. Some of the things that we cover, when we're looking at a claim, is like the cost to retreat what was damaged. General damages is your pain and suffering, your legal expenses if the claim's in litigation, and the legal costs of the litigation itself. And it's all subject to your deductible. The deductible is only charged if the insurance company has to make a payment to the patient. So if we have a claim and it's we decide that it's not malpractice and we defend it and the patient loses, you don't have to pay your deductible. Now, items that are not covered under the policy, and there are more exclusions that I'm going to go through, but basically criminal acts, practicing without a license, prohibited treatments, unauthorized acts by employees while knowingly acting outside their scope of supervision, abuse. The big one is the reimbursement of treatment fees. That is something that we do not cover. And like human rights complaints, intentional acts, legal fees without litigation, and in litigation, aggravated or punitive damages. Okay, next slide. One of the things that a lot of dentists are not always clear on is when should you report a claim to CDSPI? And there's a lot of people that I've run into that think, well, the only time I need my insurance or I need to report is when I actually get sued. And that's not the case. The actual wording is the insured must notify the company as soon as possible after one, a circumstance occurs which may reasonably be expected to give rise to a claim under the malpractice coverage, or two, he or she receives a claim, that would be a notice of claim under the malpractice coverage, includes a demand, notice, or summons. And you must notify the company, which is the insurance company, its adjusters, or to the policyholder or CDSPI advisory services. The normal process is to contact CDSPI to report your new claims. Okay, next slide. Okay, the next part I'd like to briefly talk about is reporting new claims, how the sort of nuts and bolts of a claim work, and what the actual adjuster's role is. Next slide. Okay, I apologize for my squiggly lines here. What I just want to run through is there's two diagrams here. The first one is a new claim. So the dentist, if you follow the arrows, will phone and report a claim to CDSPI. CDSPI will take the initial report and they will send that through to the company I work for, which is Crawford and Company, and myself. Crawford will open a claim file and send it to me along with a copy of your coverage. And the first thing I will do is review that and then contact you. When I contact the dentist, I'm going to first clarify the situation, what's going on, like what's happened, why is the patient unhappy, what attempts or where are we at the moment? Is the patient waiting for you to get back to them? Have you already told them to go away? You're not interested in paying anything? You know, where are we at? And the next thing I'm going to do is say, okay, how would you like to proceed? What can I do to help you? And that can be anything from, okay, I've had enough of dealing with this patient. I want you to take over. And I, as the adjuster, are perfectly capable and happy to deal directly with the patient for you or the patient's lawyer. In a lot of cases, we discuss with the dentist the best way to proceed. And sometimes that is having the dentist continue to deal directly with the patient, with myself in the background. And I can certainly give advice and direction on how best to do that, as long as the dentist is in agreement. So it's a collaborative effort at this point. It's the adjuster and the dentist within the coverage. What can we do to get this resolved, get the patient either happy or on their way, and hopefully that's where we can resolve it prior to having to go to litigation. Sometimes, you know, your first notice of getting a claim is a notice of claim in the mail. And at that point, there's not a whole lot we can do to deal with the patient and try and resolve it amicably before then. If we try and do all these, well, the other thing I do on these new claims is Zurich Insurance Company of Canada, who's the actual insurance company, is not aware of a claim until I actually notify them. So I have to send reports to Zurich to let them know that a claim has been reported, and we'll deal with that. Now, I have a certain amount of authority. I can deal with claims directly myself without their guidance. But if it gets over a certain criteria or amount, there are examiners at Zurich who will oversee what I'm doing. Now, if the claim becomes litigated, then as a dentist, you're going to get served with a notice of claim. You can, if it's reported to CDSPI already, you send the notice of claim directly to me. I send it off to Zurich, and they look after hiring the lawyers to defend you. And they have lawyers on staff, and they also have outside lawyers who specialize in defending dentists in malpractice claims. The choice of lawyer is with the insurance company. If you want to use your corporate lawyer, they'll generally say no because they don't have the expertise that the people we use have. Now, if we get a litigated claim, if you wait until you get to notice a claim, what's going to happen? The same thing. You're the dentist, you will report to CDSPI, and the whole thing goes straight to Zurich. And they use one of their examiners to oversee the claim. They hire the lawyers, and the lawyer deals with the patient's lawyer and throughout the litigation. So basically, at that point, I'm out of the picture. So all those things I could have done to help you, too late. We can't do that. So it's better for you, the sooner we get involved, the sooner you report these potential claims, the better chance we have of not getting to that litigation steps. Some are going to go no matter what, but that's, we can't help that. Next slide. Okay, so what do I actually do? The adjuster's role. And there's three basic things that I do. It's called investigation, evaluation, and negotiation. There. Okay, so I'm an agent for the insurance company. I take direction from the dentist and the insurance company. I do have some decision-making authority within a certain financial limitation, but Crawford and Company and Zurich's offices are in Ontario. I'm located in British Columbia, which is where the majority of the claims come from. I'm their eyes and ears on the ground. I report to Zurich. Crawford is paid by Zurich, and Crawford pays me. Zurich Insurance Company have the checkbook and make the ultimate decisions. When claims happen, I oversee claims all across Canada, where CDSPI carries the policies. I'm currently licensed in BC, Alberta, Saskatchewan, and Ontario. If the claim happens somewhere where I'm not licensed, I will hire local adjusters to do the initial investigation and report back to me, and I will continue to oversee the claims. So, okay, so first thing I want to do is investigate. So when I get the new claim, first thing I do is I phone yourselves and say, okay, what's happening? What's going on? Give me the details of the treatment. Why is the patient unhappy? If we need to deal directly with the patient, I will contact the patient, get their version of what happens. I explain to them what the requirements are to be successful in a claim. I may need to get records from other dentists who have been involved in the patient's treatment. I cannot get those without the prior written consent of the patient. And basically collect all the information we can so we can go to the next step, which is to evaluate the claim. And the evaluation is kind of a two-step process. The first step is there a claim here or not? Should we accept it? Should we settle it? Or should we just deny it? And this is all based on the evidence and the results of our investigation. How do we decide if a claim should be paid or not? Well, the key is standard of care. There must be evidence that the treatment or lack of treatment provided by the dentist fell below the standard of care expected of a dentist of the insured's training and experience. And that failure must be the direct result of what the patient is claiming for. And the burden of proof is on the patient. So sometimes it's simple. Yeah, I extracted the wrong tooth. It's pretty clear that, yeah, that's considered malpractice. And we've got a claim that we should deal with. And if we're going to deal with it, it's better to get it, the sooner we settle it, the better. Or we could have a complicated claim. The dentist does an $80,000 total mouth reconstruction on somebody that never looked after their teeth for the last 20 years. And about a year down the road, all that work starts to fail because guess what? The patient's still not looking after their teeth. That can get a little more complex. So again, standard of care is different for everyone, from general dentist to specialists. The standard of care is obviously higher for a specialist, but it's based on the evidence. Generally, we ask the patient to provide a report from another dentist outlining what the standard of care is and how it was breached. We'll also ask them at that point, what's it going to cost to fix it? Sometimes we get into situations where we're not sure whether there's a malpractice here or not, and we will at times hire independent dentists to review the case for us and give us their opinion, which is more of a tiebreaker. We can also review prior case law, but liability is not always clear. And we don't pay just because the dentist wants us to or feels bad. There must be evidence of substandard care. So once we decide to accept a claim, at my level, prior to litigation, I will certainly be discussing everything with you as the dentist, and I will be seeking your agreement before we do that, before we want to try and settle with the patient. If litigation has been commenced, the decision to settle rests solely with the insurance company. They can make that decision without your input. So, okay, if we decide to decline a claim, my job is to advise the patient and the dentist that that's what we're going to do. The patient then has to decide if they want to pursue the matter further. Okay. So once we decide there is a claim, now we have to figure out what it's worth. So how do we get to that settlement amount? Well, again, we go back to the documentation obtained in the investigation. Generally, we will ask the patient, what are you looking for? Estimates for cost of retreatment, and only costs directly related to the malpractice. And to give you an example of that, if a tooth needed a root canal and a crown, and due to malpractice, the tooth has to be extracted, we may pay for the implant, but we're not going to pay for the crown as it would have been needed anyways. And then we also have to make sure what treatment is related and what's not. And we run into this, for example, in infants having orthodontic care when, say, the wrong tooth is extracted. That happens. The orthodontist will refer a patient back to the general dentist to have a tooth extracted. The general dentist accidentally removes the wrong tooth. So all of a sudden, the parents want all future treatment and orthodontics paid for by the dentist. Well, what we actually pay for is any additional costs for an updated treatment plan, not the continued treatment that was already going to occur. Many of the patients I deal with are just happy to get the cost of the retreatment covered, and that's the end of it. General damages, pain and suffering, that's a negotiated amount. And in dentistry, most claims it's not that much. You're not really in pain that much, and it's not long-term compared to, say, a motor vehicle accident. Legal costs, if it's litigated, we have to look at. But the insurance company has the final say as to what amount gets offered, because they have the checkbook. So in some cases, they'll provide instructions to me, and I will discuss and get the agreement of the dentist, try to settle a claim with the patient or their lawyers. There are times when the dentist is happy to handle the settlement directly with the adjuster in the background. Okay, so as far as now, we've got an amount, we've decided we want to try and pay the claim. Now we want to try and settle it. So the next step is to try and negotiate a settlement with the patient or their lawyer. So I'm working on behalf of you, the dentist, and they're the insurer. I have no obligation to assist or advise the patient regarding a settlement amount. I will negotiate with the patient or the representative. If we can reach an agreement and I get a final release document signed, and the insurance company issues a check for the full amount. Once the release is signed and the payment's done, the dentist is then sent an email from me asking for their deductible once everything's finished. And there is no internal appeal process of the decisions. If we cannot reach agreement, the next step is for the patient to proceed to litigation. Okay, next slide. Okay, some things that I can't do for you. I do not deal with the colleges. That's a separate issue. Claims and college complaints are two separate things. What I do on some occasions to help the dentist out is they can write their response to the college. I'm happy to take a review of it before you send it in. In British Columbia, the BCDA has recently put in a program where they will provide a legal assistance to help you respond and deal with the college. Bad reviews on the internet, not much I can do about that. I'm just not internet savvy enough, and I don't know how you dispute them, but I get asked that a lot. I cannot assist with the collection or credit card issues. I saw one of the questions earlier was about people paying with a credit card and then going to the credit card company and saying, no, I'm not happy with the payment, I'm disputing it. And the credit card company just takes the money back from you. I don't know how they can do that, but they do. And I only handle malpractice claims. I don't handle the triple guard, property damage, things like that. We have other adjusters at Crawford who do handle them, and they're very good at what they do. Next slide. To give you some examples of some claims that I've dealt with, and these are actual claims. Patient claims injury to their thumb when using sandpaper to self-adjust a crown that she was not happy with. Patient swallows a mirror during a hygiene appointment, goes straight to a lawyer and demands $25,000 for aggravation of a pre-existing dental anxiety. We had a claim that had been going on for like 7 years. The patient goes for treatment at a specialist. He's not happy with the results, so he sues the dentist and gets opinions from 2 other specialists. The claim is settled. the patient goes to one of the dentists who gave the opinion and starts treatment with them. They take 70+ visits, and $40,000 later, guess what? The patient's still not happy with the results and wants their money back. So the other specialist who gave the opinion against the first dentist is now giving an estimate of $60,000 to fix the second specialist's work. And this is still ongoing, or was the last time I heard of it. We get a lot of claims for patients complaining of paresthesia after either a dental treatment or a freezing injection. Extraction of the wrong tooth, we do get those. We've seen this a couple of times. The referring office has made a typographical error when they sent a referral to a specialist and asked to have the wrong tooth extracted. And in this case, the patient had many teeth that needed extraction, but only wanted 2 specific ones done. So when the specialist saw the patient, they confirmed by examination and verbally that the teeth on the referral form need to be extracted. And then after the patient had the teeth taken out, they were upset and wanted to make a claim. Another reason for extracting the wrong tooth, looked at the x-ray backwards. That's film x-rays. Orthodontic, kids don't wear their retainers and they relapse and they try to blame the dentist for the cost of retreatment. Invisalign claims. We had a CDA taking an x-ray and tripped over the cord, pulling the mouthpiece from the patient's mouth, and they claimed injury to their neck as a result. Claims that I don't like to see are full mouth reconstructions. Again, people who have not looked after their teeth for years are not going to start now. You need a really good informed consent and the patient's understanding of what's required to look after them. Common claim is fillings that don't settle down, need root canals, and the patients are always looking to have the specialist costs covered. Failure to diagnose cancer, infections after treatment, and even as bad as fatalities in the chair, generally from heart attacks. Next slide. Okay, things you can do to help yourself. Notes, notes, and more notes. You can never have enough notes. It's probably the biggest complaint you will see coming out of college complaints is notes. The more detailed, the better. Consent forms. Well, we have so many claims where one of the issues, especially the lawyers bring it up, is failure to obtain proper informed consent. And what I've seen in court cases is if you don't get a written consent form signed, you have to have detailed notes in your chart explaining what was discussed verbally. If the patient didn't get consent, it's very difficult to argue without that documentation. Photos. Photos are always good things to have. Photos worth 1,000 words. And communication with the patient. Don't be afraid to spend an extra minute or two explaining to them. If you can keep a good rapport with them, be honest with them, explain what's happening, even when things go wrong. Talk to them, tell them, explain to you, they need to go to a specialist or whatever. Sometimes it's better to come from you. I know a lot of offices use treatment coordinators and have their staff get consent forms, but the best is always for you, the dentist, to talk to the patients and make sure they understand what's going on. The emergency protocols for staff to deal with emergency situations. And that can be anything from a heart attack. I had a claim where person stopped breathing in the chair, and the entire office staff had just come back from a CPR course, and they had one of those defibrillators, and they knew exactly what to do, and the patient survived with no problem. The patient's family was really happy with the way they were treated. Could have gone worse. But also think of protocols for dealing with irate patients at the front of the office when they come in. You know, do you need to call the police to get them removed? And that has happened. But if your staff knows how to deal with these situations, it goes much smoother. Again, recognition of potential claims. You know, if something's going sideways, think about the potential. Contact CDSPI. I'd rather get a claim that doesn't blow up than one that does. This is something that doesn't happen much, is calling the prior dentist to see if there were any issues. I know dentistry, especially in BC, is highly competitive, but you know, there's generally, if a patient comes in and they're brand new to your office, says, yeah, I didn't like my old dentist, he was miserable. Well, it doesn't hurt to give them a call and say, oh, what's really going on here? Like, do I want to treat this person? Again, don't wait to report. I've got no problem with trying to resolve a situation on your own. But if it isn't working, let's talk about it. Let's get it done sooner rather than later. So again, don't wait to report to CDSPI. And I think that's the end of my slides there. Yes. So at the end, we can answer any questions for you.
Thanks, William. Just before I hand things over to Colleen, Ed wanted to say a few words.
Yeah, thanks, Stephen. And thanks, William. We noted through the Q&A, there are some common questions, and maybe to illustrate, you know, William's last point about don't wait to report to CDSPI. I know because we have a lot of attendees that are from Ontario, and so I think there's some confusion based on some of the questions that have been submitted. If you are practicing in Ontario, it's the RCDSO and the PLP program, or their malpractice insurance. They are your primary malpractice insurance provider, and therefore you should be contacting them. You know, where it's saying, well, you should contact CDSPI, that's in the cases where, you know, outside of Quebec, Alberta, and Ontario, where we provide the malpractice insurance, you should be contacting us. But in those provinces, Ontario, Quebec, Alberta, where they're providing your primary insurance coverage, you should be contacting them. There is one exception. In Alberta and Ontario, we do provide excess malpractice. So above the $2 million that comes with your license in those two provinces, you can purchase excess malpractice through CDSPI for coverage of an additional $1 to $23 million. So if you have excess with CDSPI, you would probably be contacting both your Alberta or Ontario malpractice insurance provider. And then if you have excess with us, you would also let us know as a matter of course. So I just wanted to point that out because I think there's been some confusion. So hopefully that addresses a lot of a number of the questions.
Thanks, Ed.
I'll turn it back to you, Stephen.
So at this point, I'd like to introduce Colleen O'Neill. Colleen is a senior associate at Dolden Wallace Follick, LLP. Colleen joined the firm in 2012. She has a broad scoped insurance defense litigation practice, including personal injury, property damage, occupier's liability, and professional negligence. From early into her career onward, defending dentists on allegations of professional negligence has been a focal point of Colleen's practice. Since 2021, Colleen has been Dolden's lead contact for dental malpractice claims. She's co-authored a resource paper for her clients titled Professional Liability for Dentists in Canada, Managing the Risk. Thank you for being here, Colleen.
Thanks, Stephen. First of all, thanks for having me. I'll jump right into it. I'm going to start off with an overview of the law that shapes how dentists get sued, and then we'll go through the typical claims that we see and some practical tips to avoid these claims and to defend yourself if you do get sued. So professional negligence, what is it? There are three elements that make up the general rules of negligence. First, the professional owes a duty of care to the claimant. In dentistry, this is always assumed. A dentist owes their patient a duty of care, full stop. Secondly, the dentist failed to meet the requisite standard of care. I'm going to get into this next. And then thirdly, the breach of the standard of care that occurred actually caused the loss or injury that should be compensated. So for example, it is often an allegation or a finding by the college that a dentist breached the standard of care for record keeping. However, this breach rarely actually causes the loss or injury to the patient. It just makes our job a lot harder to defend the case. Now, the legal standard of care for dentists, like other professionals, is that they must provide dental services to their patients in a reasonable and prudent manner. In other words, a breach of the standard of care occurs when a dentist fails to exercise the degree of judgment and skill ordinarily possessed and demonstrated by members of the profession practicing under similar circumstances. So whether a dentist has 1 year or 30 years of practice, they will be held to the same standard. And this also applies for specialists, as for example, an orthodontist will be held to the same standard of care as a reasonably prudent orthodontist. Now, in order to establish what the standard of care is, the patient will typically need another dentist at the same level to provide an expert opinion to establish what the standard of care is, that the dentist breached that standard of care, and that this breach actually caused the plaintiff's injuries. Now, this is required because dentistry is a technical subject matter outside of a judge's ordinary knowledge and expertise. A strategy that I commonly see is for a patient's lawyer to recommend first making a complaint to the college in order to get essentially a free expert opinion. While that expert opinion from the college cannot be used to prove the patient's case in the lawsuit, it typically gives the patient's lawyer an idea of whether it's worthwhile to take the case and invest money in getting their own expert opinion, while it also provides them an understanding of the case and the dentist's position. Cases are frequently dismissed when the patient fails to get this expert evidence from another dentist. And in particular, this happens in small claims court, where a lot of patients are self-represented and typically have a harder time obtaining an expert opinion on their own. Now, the other major legal concept for dental malpractice cases is informed consent. Pretty much every lawsuit against a dentist that comes across my desk includes an allegation that the dental treatment was provided without informed consent. So what is informed consent? Patients have the right to make a reasoned and informed decision regarding their healthcare. Informed consent is a legal concept and is given by a patient to a doctor for treatment with full knowledge of the possible risks and benefits. A patient's consent to treatment may be vitiated if there's no disclosure or incomplete disclosure of the material risks. And what needs to be disclosed to a patient is not what a dentist necessarily thinks is relevant to disclose, but rather what a reasonable person in the patient's position would need to know and understand to provide valid consent. So the standard is a reasonable person in the patient's position, because every patient who sues is going to retrospectively say that they would have never agreed to the treatment had they known of the risk that has now caused their injuries. So the court considers instead what would have been a reasonable decision in that patient's position. So for example, in a recent BC case, the fact that a patient was embarking on a new career, which involved a lot of travel and was suffering issues related to a wisdom tooth, the court held that had the patient been informed of all the risks, a reasonable person in this situation would have agreed to the extraction of their wisdom tooth. So the disclosure standard, it has three components. Firstly, was the risk material, unusual, or special? If so, should the doctor have disclosed that risk? And if so, did the breach of the duty cause the plaintiff's damages? So to determine if the risk is material, unusual, or special, consider that risks that are not likely to occur must nevertheless be explained to a patient if they would have serious effects. So an obvious example of this is if there's any risk of death, even if it's extremely remote, this needs to be explained. Conversely, if a risk which would have a minor effect on the patient, but could likely happen, then this needs to be explained. So for example, a chance of failure or further work needed. Another example of this is where the odds are 1 in every 100,000 wisdom teeth extractions results in a jaw fracture. The risk was found in a case to be low and no warning was required. So materiality for the duty to disclose the risks. It's important to keep in mind that the subjective concerns and unique nature of each individual patient also determines the materiality of a risk. I had a case where an implant failed and the consent form quoted a specific high percentage for how often implants were successful. Now, first of all, the percentage quoted was likely wrong and misleading, but also this patient had some unique features that the plaintiff's expert was able to say increased the risk of failure. And as a result, they argued that the patient wasn't properly informed of the risk of the failure by being provided with an incorrect percentage. So materiality involves a consideration of the following factors: the inherent risk of treatment, whether the treatment ramifications are serious, the frequency of the risk, the information normally given to patients undergoing the same procedure, the gravity of the patient's condition. So, for example, if a dentist is correcting a bite because of ongoing TMJ, the risk of ongoing pain is different than if you're correcting the bite for purely aesthetic reasons. The importance of the benefit of the treatment, any need to encourage the patient to accept the treatment, the intellectual and emotional capacity of the patient, the information the doctor knows or should know that the patient deems to be relevant to his or her decision to choose a treatment, evidence from the patient, and in some rare cases from his or her family as to the information the patient would have wanted to receive before electing to undergo or refuse treatment. So now moving on to defending informed consent cases. Now, is a consent form on its own sufficient? I'm sure you've heard it before. The answer is generally no. It's not just a piece of paper. It's an understanding between the patient and the dentist and includes the substance of the discussion between the doctor and the patient. I frequently hear that a patient was given a consent form by the receptionist or the dental assistant, and that the extent of the dentist reviewing it with the patient is to ask whether they have any questions about the form. Now, these cases are very difficult to defend. More needs to be done to obtain informed consent. There needs to be a conversation with the patient about the risks and benefits of the treatment. There needs to be a conversation with the patient about the treatment options, usually including the option of doing nothing. There needs to be efforts made to ensure that the patient understands the conversation and the consent form. If the patient has difficulty with English, this may include having the patient bring someone with them that can translate for them. I had a case where it was known that the patient couldn't speak English, and they had filled out various translated forms in their own language. However, the consent form was not translated. So in a case like that, the consent form doesn't provide much, if any, assistance in defending the case. And I can't say enough how important the records are for defending informed consent cases. Patients who sue pretty much always deny that they were properly explained the risks of the treatment and claim that had they been presented with the risks, they would have not agreed to the treatment. It typically becomes a patient's word versus the dentist's word. In a lot of situations, it's hard for the dentist to recall exactly what the conversation with each patient entailed, as they have so many similar conversations with their patients every day. The records are the key to having the dentist's evidence preferred over the patient's. I want to go through one example of a case I had where a dentist was extremely thorough in his documentation. On the consent form, he had the patient initial every risk, and he made his own notations on the consent form, such as underlining and adding words that he made as he was reviewing the risks and the treatment options with the patient. They, of course, both signed the form, and he also made a notation in his clinical records with an abbreviation, which, according to his usual practice, confirmed that he discussed the risks and benefits, treatment options, and would have used a model to assist in explaining the procedure. Now, these records allowed us to successfully defend the dentist at trial, and it's a great example of how to obtain informed consent and how to properly document it. I'd highly recommend following this practice. Another useful tool for defending cases is to have a consent form customized to the specific patient. So, for example, if there's a multi-stage treatment plan, have this written out and signed by the patient. On numerous occasions, an issue that has arisen is that a patient has not completed the treatment plan. So to have a customized consent form outlining the steps that the patient should have taken and which were explained to them has been essential in defending these cases. And consent forms for different treatments are also a good idea. So, for example, one form for implants, another form for extractions. And every once in a while, I get consent forms that come across my desk where there's no specific reference to the actual treatment provided, and a patient just signs that the risks and benefits were explained to them, with no risks or benefits actually listed. I also can't tell you how many times I have consent forms that say alternative treatment options were discussed, but when I ask the dentist, they admit that no other treatment options were ever discussed. So these type of forms are not at all helpful for defending informed consent cases. A lot of patients also claim that they were not told how much the treatment will cost. And it's important to provide a quote to the patient or note in your records of what treatment costs have been discussed. I want to go through some typical dental negligence cases that we see. So first of all, poor craftsmanship. This includes faulty crowns and bridges, aesthetic issues, cuts to the patient's lip or tongue, fractured root tips remaining after extractions, hitting a nerve. Now, often patients, unless it's properly explained, don't understand that some dental work can be unsuccessful and need to be redone or need further work. And if it's not properly explained, the patient can get upset and blame the dentist, and it potentially leads to a lawsuit. So inattention to the patient and their patient records. Extraction of the wrong tooth. It's surprising how often we see this, but these cases are generally not worth that much, luckily. Failure to diagnose cavities and periodontal disease, failure to diagnose a tumor, problems associated with TMJ disorder, complications arising from a failure to obtain an adequate medical history, and problems associated with anesthesia. Now, I had a case where there was an issue of prescribing medication that the plaintiff alleged she had an allergic reaction to, which she had noted in the records. Now, this could have been avoided with properly reviewing the records, but unfortunately, it was missed. Another common issue we see being important in the medical history is being a smoker. I had a case of a chronic smoker who had treatment in which smoking influenced the recovery phase, as it typically does. And it was alleged that their noted history of smoking was never discussed with them, and there were no warnings to not smoke during the recovery phase. And as you can imagine, they smoked, and then they suffered a significant infection during that recovery phase. Communication breakdowns, so failure to obtain informed consent and failure to inform the patient about a problem during a dental procedure or treatment. So for example, if a file breaks off during a root canal, you need to tell the patient what happened and provide the option of removal or leaving it, the option of referring to a specialist, and make sure to record the conversation in the records. Injuries consequent to treatment, so infection after tooth removal, aspiration of foreign objects such as crowns and implants, puncturing the sinus, TMJ issues, nerve injuries, pain and numbness, slurred speech and biting of the tongue. And general family dentists taking on work that requires a specialist. So failure to refer patients to a specialist to obtain second opinions and performing work outside of the general dentist's expertise. Now, it's important to refer a case out that is too complex, or if the case requires access to specialized equipment. And if you are a general dentist, be clear to your patient that you are not a specialist. This frequently becomes an issue for general dentists who limit their practice to areas where there are specialists in. So for example, oral surgery, and the patient is not aware that they're not a specialist. A dentist simply saying that they never said they were a specialist is often an issue, and rather the patient should specifically be made aware that the dentist is not a specialist. So I want to go through some practice management tips for when a problem does arise. Now, firstly, this should be obvious, but remain calm. Notify your professional liability program, as William said. Now, also instruct staff not to speak with anyone inside or outside the workplace about the incident, and also follow this yourself. I had a case where the dental assistant started discussing the case with a friend in a waiting area of another office, and the patient's sister happened to be the receptionist there and overheard the conversation. Needless to say, this case escalated quickly to a lawsuit. So do not admit liability for the alleged error. You never know what a patient's demands are. You know, I had one case where the dentist volunteered to pay for a removal of a drill bit that came off during a root canal. And then the treatment cost would have been about $1,000. Then the patient's demands started flowing in for an implant and about $10,000 worth of work. Ultimately, it ended up in a lawsuit, and one of the allegations was that the dentist had already admitted he was liable and agreed to pay for treatment. Another case where the dentist admitted to their college in regards to a complaint that she made a mistake. But when she was sued and I was interviewing her, she said she did this to be cooperative with the process and didn't actually think she made a mistake. Unfortunately, it's very challenging to defend a case where there's already been an admission of guilt given to the college. So don't ignore the problem and assume it'll go away. It generally doesn't. Do not contact a patient who has started a lawsuit against you or retained a lawyer. Don't talk to the patient's lawyer. Instead, refer them to your insurer or your lawyer. Do not treat the patient after the lawsuit begins, except in an emergency. Do not seek information about the patient from other providers. I've seen this on a number of occasions where, and I'm talking about once the claim starts, where dentists call other treatment providers inquiring about the patient, or see a dentist at a conference and discuss the case. Now, it's typical that in an examination for discovery by a patient's lawyer, which is being questioned under oath, that lawyer will ask who they've had conversations with about the case, and then ask for the contact information for those people. The lawyers are allowed to ask what the contents of that conversation were and interview the other people you spoke to about the case about what was said, as there's nothing confidential about the conversation. So it's important to be careful about who you're talking to about the case, and also keep in mind your patient confidentiality obligations as well. Do not give away your original records. I've had a situation where my client sent originals, including models, to a new dentist, and then had a problem getting them back to defend the college complaint and lawsuit, as the patient had ordered their new dentist not to return my client's files. I cannot stress this enough. Never alter or add any notes to the patient's records. Instead, if once you realize there's been a problem, and that you may have missed something in your records when they were originally written, do a memo with the current date made out to a lawyer to keep it confidential of what you recall. Do not make any chart notations about the legal action. Do not write on original records. Some clients have marked up originals to highlight what they think is important for their lawyer to know in the case, and this can create some issues. So what information is needed for claims handling once it gets to litigation? The first thing we always ask for is the full dental file, which includes much more than just the clinical notes. It also includes the medical background information, consent forms, x-rays and radiographs, photos, molds and models, emails and text messages. And I'll pause there and I'll say, you know, more and more dentists are emailing and texting with patients, and that's fine. But it's important to remember that these form part of the file and will be producible in the litigation. So it's important to keep these communications professional with the assumption that a judge could be reading them at a later stage, similarly to your clinical notes. As well, financial ledgers and estimates, teaching aids, which can sometimes form part of the informed consent discussion, as well as reception records. With reception records, sometimes there are issues, for example, with the follow-up on how long it took for a patient to book a follow-up appointment or complaints that they could not get in to see the dentist. So records of calls and voicemails can sometimes be important. I had a case where my client blamed a patient for not returning quick enough, like they were told following issues with an implant. However, the patient claims they were not able to get an earlier appointment when they first returned. So it makes the reception records very important. I'm going to wrap up with some dental record keeping best practices. Dental records should be written in ink, not pencil. You don't want to be able to alter them. Legibly written, or ideally, preferably typed. Check for accuracy. In particular, if the records are dictated or entered later, which I don't recommend, written at the time of treatment. It is not good practice to make the notes at the end of the day or at a later day rather than during the appointment. These are some of the worst records that I see. And also identifiable by author. So putting the initials of the author of the records is good practice. I actually had a situation that arose where I was prepping witnesses for trial and for a key appointment with notes regarding consent. There was actually 2 different dental assistants, both that said that the handwritten notes were their own. Luckily, we were able to go back through the records and identify that one of them was not working on the day of the appointment to avoid it becoming a big issue, but simply identifying the author could have avoided any confusion. So that concludes my presentation. Hopefully it was informative for understanding the law and for both preventing potential claims and also knowing what to do in case you do get sued. Thank you.
Thanks, Colleen. I'm just going to give Renata a second to pull up her slides. So now I'll introduce you to Renata Whiteman. Renata has 20 plus years of experience here at CDSPI in the advisory services area. In her current role as a senior advisor, Renata works with a range of clients, including dental specialists, general dentists, and students, providing insurance and risk management strategies to meet their specific protection needs. She's driven and passionate about helping her clients, and she enjoys speaking at dental industry events across the country, including sessions like these. Renata?
Thank you. Okay, so thank you both for the presentation. I'm gonna just wrap up talking a little bit about our malpractice. So for all of you outside Ontario and Alberta, you do have our plan. We have several limits that you can choose from minimum 3 million. You can go all the way to 25 million of coverage. Includes, like William said, legal representation, and you also can be reimbursed for the time that you spend in court. One question that I am asked all the time, how much should I apply for malpractice? It all depends on your level of comfort, demographics, and I always suggest, for peace of mind, to go to the maximum. If you look in terms of premium, a $25 million of coverage with a 75 million aggregate, you are looking at approximately $2,500 a year. So always keep in mind, we are not looking for the small claims or the small things that happen. You're always looking for the big one, you know, that day that something goes wrong. So it is important, but most of all, it's your level of comfort if you are a specialist, what you do in the office. I always say the more complicated the procedure, the higher the chances that something is going to go wrong. Another question is, what if your practice is incorporated? Like William said, your company, your corporation is automatically included under the malpractice, but it's always good to have the corporate name added to your malpractice. And I think this is a requirement of your college as well, that if you're incorporated, they want confirmation that it is insured under the malpractice. You just give us a call, give us your corporate name, and we add it, and there is no extra cost to that. If you move outside the province, provided that you are licensed in the province or territory that you are going, your malpractice goes with you, wherever you go, outside Alberta, Ontario, and Quebec. You just need to notify us that you are being licensed, for example, BC, Saskatchewan, or Saskatchewan, Manitoba, so we keep a record where you are licensed. But one plan goes with you. I already mentioned how much do you need. And this is just an idea. Just to add, PI now increased the minimum limit of their requirements from 3 million to 5 million. And in terms of premium, anything between 3 million to 5 million, the difference in premium, it's approximately $130 a year. So I'm having lots of clients that they are increasing their coverage from the minimum 3 to the 5, and some to the 25 million. And additional benefits that you can have with our malpractices, we do offer the non-practicing status. Always remember, the non-practicing goes with your license. So if you're retired, if you are on disability or on mat leave and you surrender your license, notify us. We change to a non-practicing. This non-practice will remain in effect as long as your license is in a non-practicing license. And when you're retired, it remains ineffective as long as the insurance company agrees to it. And some of the questions is why this is important. Always remember, our policy, it's what it's called claims-made policy. So it's not when you did the work, but it's when the claim is reported. So you can retire now, and 2 years down the road, a former patient comes and starts suing you for malpractice. You need to have the coverage at that time, and that's the main reason we offer the non-practicing status. Hygienists, certified dental assistants, dental therapists, dental nurses, they can also purchase malpractice with us. We protect both you and your corporation. And you have, if you choose the 25 million, up to 75 million, and this is your individual aggregate limit. It's not shared with the group. So that it's very important. If you are in Ontario and Alberta, you get your basic coverage through your license. However, you can buy, like Ed said, the excess malpractice. The minimum limit in Alberta and Ontario that you get is the 2 million. With CDSPI, you can purchase an extra 1 million. So at least you have, the total 3. You can go all the way to 23 million, giving you a total of 25. Always, the mandatory 2 million that you come from your regulator. Just for you to have an idea, $1 million in excess is costing you $70 a year. 23 million of excess is costing you $838 a year. So for those in those 2 provinces, you can come to us and get the extra coverage that you need. And our excess malpractice follows your primary, but it also gives you provision for the legal representation. And again, like said by William and Colleen, what if a claim? Contact CDSPI as soon as possible. Any situation that may arise to be a claim. I always say can be a comment that the patient made at the front desk, a phone call, an email that you got, and sometimes the client said, Renata, the patient didn't say anything, but I have that feeling that it may become something. Give us a call, we report, we send to Crawford. It doesn't increase your premium. You can have as many claims or report any claims that you want. It's not going to affect on your, we are not going to increase your premium because of that. So contact us, don't negotiate with the patient, always follow the instructions. William is there to help you. And, you know, if not William, another adjuster will investigate and make the recommendation. So here you have the information. Sorry that I went too fast, but I think there are a lot of questions and, due to timing, if you have any questions, contact us. Any specific questions, email me and I'll do my best to answer to you. And now, Stephen, I'll pass to you for the questions and answers. And if you want to take a minute for the survey, would help us for the next webinar that you have. Thank you.
Thanks, Renata. And as she indicated, if you take the next minute to fill out this feedback form on the QR code, the feedback is extremely valuable to us. It enables us to deliver sessions that are meaningful to everyone, including sessions like this evening. So now we've reached the question and answer portion of our session. And I just want to respect everyone's time. We'll focus on this for the next 15 minutes. We did have, as Renata indicated, a slew of questions come in. And I just want to apologize ahead of time if we don't get to your specific question. We will be sending out a follow-up with contact information to connect after the session if you want to continue with our dialogue here. So William, why don't we get things started off with you? And this one came through. Does the CDSPI insurance allow us to decide if a malpractice claim is settled, or is the decision up to the insurance company?
Okay, that depends on the claim and where we're at in the process. Certainly, if the claim is non-litigated and you're dealing directly with me, you have input into whether the claim is settled or not. Certainly, it doesn't make sense if you think you've got a strong case not to settle the claim, then we probably shouldn't. If the claim becomes litigated, unfortunately, that decision is made by the insurance company and their lawyers, and they have the ability under the insurance contract to settle these claims without your input.
Thanks, William. Colleen, any advice you would give for an associate who doesn't have a lot of control or say in the running of an office towards malpractice?
So that's an interesting question. I think I made the point in my presentation that a dentist with 1 year of experience is held to the same standard of care as a dentist with 30 years experience. So the reality is it might be an uncomfortable situation, but you have to practice in a way that you're comfortable with. Just because you have a senior dentist who you might be working for who's doing things that you're not comfortable for, you can't put the blame on them that's why you're copying them, essentially. You're responsible as a professional to meet the standard of care. So you need to kind of take charge of your own practice.
Thanks. William, are there any instances where a dentist could refund work without implicating themselves potentially for a later lawsuit?
Basically, the only way you can protect yourself, even when just giving a refund, is by getting the patient to sign a full and final release of all claims. Once the patient signs that form, that stops them from being able to take further action in the future. If you don't get that form signed, then you take the risk of the patient coming back for more money later, and then taking the initial payment you gave them and trying to twist that around into an admission of responsibility. So the only way to avoid it is to get the release document signed.
Thanks. Renata, how many claims are allowed before premiums increase?
There is no premium increase because of claims. So as a group, of course, the rate increase on malpractice, it has to do with our claims experience. So the less claims we have, the better we can, the higher the chance that we can give it back to you and decrease the premium. But you are not going to be penalized because you put 1, 2, 3, or 4 claims in a year period. So if we do have an increase, every single dentist, regardless of reporting a claim or not, will have the same increase. So don't be afraid to contact us to report any situation. And don't forget, most of the time, they don't go anywhere. It's just a matter of letting the insurance company know, they put a reserve, and then they just wait, right? And sometimes it doesn't go anywhere. So no worries about premium increase because you are reporting a claim.
Thank you. We got a question about student licenses. How are they insured, and what if they have a complaint or a claim? William, do you want to take that one?
Student licenses, my understanding is they're licensed just like any other dentist. Renata may know better than me.
Yeah, some provinces, they do have programs sometimes during the summer where the college issues a student license for 2 or 3 months. And we do offer, there is a malpractice coverage for students. There is no premium, it's no charge. And it works the same way as a normal license, meaning you are, the student, it's going to act within what they are supposed to do that comes from the license. The malpractice will respond if in the future there is a claim. And when that period of license ceases, their malpractice, the student malpractice, goes on a non-practicing. So 2 years down the road, there is a claim from something that they did while they're students. They have the coverage. Is different than having a full license, as long as they follow the guidelines issued by their college and their, university, what they can do. I'm sure they are under the supervision of a dentist, but yes, we follow the license issued by the college.
Thanks, Renata. Colleen, how often does a civil malpractice suit also coordinate with a college complaint?
It's an interesting question. I would say, from my own experience, it's over 50%, but it's not 3/4 of the time. I think it's becoming more and more common that lawyers are recommending to make the complaint to the college first. So I think that the frequency of the college complaints is increasing. But certainly it's not in every case. And, it often happens, I think that, a patient will complain to the college, and then the college will inform them that they can't get any money out of the process, and then they go to a lawsuit. So we do see that typically.
Okay, and while I have you, I know we did get a slew of questions about standard of care and I know you did an excellent job of going through it, but maybe just highlight this one. A GP doing orthodontics versus an orthodontist specialist. Please explain why or why not the standard of care is the same.
So, it's interesting, and it really depends case by case. A lot of the time, a general dentist who is doing work that is the same as an orthodontist, essentially the standard of care will be the same. So it may be a different expert that's required in order to prove the breach of the standard of care. So for an orthodontist, you're going to need another orthodontist. For a general dentist, you're going to likely need a general dentist who does orthodontic treatment. However, in the actual practice, the actual litigation, I usually find that the requirements for the standard of care are pretty similar.
Okay, great. Just one more in sequence here. Is it a problem if you finish your notes the day after or a week after, Colleen? Treatment?
I'm not aware of any rules that say that you can't do it. From my experience, I think I mentioned it, I do see this from time to time, and it's the worst records I see. There are details that are missed. It becomes very kind of the same language used over and over in all the records, because it's just impossible for most people to remember, what exactly the conversation that took place. And it's not as convincing in front of a judge, when you're saying, oh, I took that note during the conversation versus, I wrote that note a week later because I remembered it. So it certainly is the best practice to do your notes at the time of the appointment, or at the end of the appointment too. You might want to go through and add things, but I certainly wouldn't wait till the end of the day or days after.
Thank you. William, I think this one's yours. What happens if a patient gets a full mouth rehab, does not pay the full amount, after repeated invoices, doesn't pay the full amount, and the patient decides to pursue a claim?
Okay, well, there's two parts to that. One is the patient doesn't pay. Okay, your malpractice insurance does not assist you with collections. So whatever process you use in collecting your fees would be what you would follow. Now, if the patient starts a legal action because they feel the job was not done up to standard, that's when we would get involved and investigate and make a determination whether they had a claim or not. So yeah, I do get questions about this quite often. I know one of the questions was, what happens when the patient calls up their credit card company and cancels the patient? And I was almost a little shocked to find that the credit card company just pulls the money back out of your account and cancels it. So yeah, collections is one of the things that I can't help you with, unfortunately.
There's a question that came in here about what about if we move to the USA? Will our plan follow us? Renata, do you want to take that one?
Hi, yeah. Unfortunately, our plan does not extend it to US. So if you are, for example, in BC or Manitoba or Saskatchewan, you are keeping your active license here in Canada and moving to the US, you keep your malpractice active and pay the premium. However, your malpractice from Canada does not extend it to US. The liability is too big. I don't think any insurance company here in Canada wants to cover, someone in the US. So you would be well advised to look for a broker or insurance company that will issue malpractice there. So,
Renata, what about maybe a different slant on the question? If they're moving to the US because they're retired and they've given up their license.
okay, they still have they are not practicing in the US, then they keep their malpractice here in a non-practicing status, if there is ever a claim, even though they're living in the US, they were licensed in Canada, they worked here, and their malpractice, it is in a non-practicing here. So we would defend, but not for any actions or work done in the US.
Right. Only as a non-practicing, like if you gave up your license in Canada, but in this case you moved to the US as a non-practicing dentist, you would still be covered for past.
Oh, you still have your non-practicing. So at the moment you surrender your license, you decide to retire, contact CDSPI. We have a form that we send to the licensing body. They confirm the date they removed your license, your name from the roll of active dentists in that province. And on that day, we change your malpractice to a non-practicing, and that becomes indefinite. We have clients, their state now is being protected for malpractice.
Thank you both for that. Colleen, what's the legal age to give consent for treatment?
18.
And then since you answered that one so quickly, somebody asked where they could get the release documents from.
I'm not sure that's a question for me. I'm not sure if there is any precedence available. I know that I typically hear from dentists that through study groups or their colleagues, they share consent forms, but I don't know if there is a standard consent form that is available or just provided. So I'm not 100% sure on that, but I do know that it's common practice to kind of be informed by your colleagues and to share amongst them.
I think it's the release form for the patient to sign.
You're
This
talking
is
about
what you meant, Stephen, release?
It says consent.
Oh, I understood the release form.
If you need a final release form, then we do have a standard form that I use when settling claims. It was actually developed by the BC Dental Association. And you can either get copies from myself or the BC Dental Association. I'm not sure what they have available in other provinces, but if anybody needs one, they should probably, if they need a release, they should probably be reporting a claim to CDSPI and asking for one. That way I can give it to you and help you fill it out ahead of time.
Thanks for that. And maybe we'll just end with this one. It's just a general question, not a lot of clarity on it. Is there a statute of limitations, time limit? I'm assuming.
Yes, I think that's a question for me. Every province is different. So every different province has their own limitation act. So it's not a clear-cut question, and it's also not clear-cut in terms of 2 years from the date of the treatment is when a patient's right to sue ends. A lot of the times, the time doesn't start ticking until they start having an issue. So until the time that they should know that there's a problem with the treatment and that they should sue their dentist. So, a lot of provinces have, an ultimate limitation period where you, for example, can't sue after 10 years. But it really isn't clear cut in terms of, 2 years from the date of treatment. And there's quite a bit of case law on establishing when the clock starts ticking. And that can even entail, you're having pain and that you need further dental work, but that still might not start the clock. It might actually be when a lawyer tells you that you should sue. So it's a good question.
Good question and great advice, Colleen. Renata, can I get you to advance to the next slide, please? Thank you. I want to take a minute to invite you to connect with us on Instagram, Facebook, LinkedIn, Threads, and YouTube. Here you'll find more up-to-date information where we continuously feature educational articles, learning tools, and interesting posts catered to the dental community. And we've reached the end of our session. I want to thank all our panelists. So Ed, William, Colleen, and Renata for all your insights this evening. Thank you to all those that participated here. We appreciate your time this evening. And this concludes our webinar. Have a great evening, everybody.
Thank you,
Night,
everybody.
everybody.
Have a good
Bye now.
night.
Good
Thank
night.
you. Bye.